Now, what are the different classes? We have seen there are 5 classes of antibodies, and it is depending upon the which chain, heavy chain. Okay, depending upon heavy chain, we have 5 classes. They are IgM, IgG, IgA, IgE, and IgD. Okay, so here heavy chain type is mu, here it is gamma, here it is alpha, here it is epsilon, and here it is delta. So depending upon the type of heavy chain which is present, they are labeled into 5 different classes. Okay, then what is the percentage of the total antibody? This can be asked as a SBA. Maximum percentages of that IgG type of antibody. Okay, 80% is the IgG type of antibodies. Okay, then IgA, that is secretory antibody, it is present around 13% of the total. IgM contributes 6%. So maximum percentage is by 80%. Then this is 13 and this is half of that. So IgG followed by A followed by M. Okay. Then fixes the complement. Which antibodies will fix the complement? Both the primary response antibodies and secondary response, both will fix the complement, but rest 3 will not fix the complement. So complement fixation is seen with these IgM and IgG type of antibodies. Then what is the function of each? The function of IgM is the primary response, fixes complement. Monomer serves as a B cell receptor. Okay, while IgG is mainly in the blood antibody, it neutralizes the toxins and it is also causing opsonization. Okay, then IgA type of antibody, it is secreted into mucus, tears, and saliva. Then IgE type of antibody, it is an antibody which is responsible for allergy and anti-parasitic activity. And IgD antibody, it is the B cell receptor. Okay, actually the function of IgD is not very clear. Okay, so they generally ask this IgM, IgG, IgA, and IgE. Okay, so the questions will be on these 3 or 4 antibodies. Okay, now let us see about IgG. We have seen already 70 to 80% of the total immunoglobulin will be IgG. The longest half-life around 23 days for IgG. There are 4 classes: IgG1, IgG2, IgG3, and IgG4. So this IgG is again of 4 types: IgG1, IgG2, IgG3, and IgG4. Okay. Then what is the function? It crosses the placenta, gives passive immunity to the fetus. Then complement activation. Among complement activation, highest response is with Ig3, followed by Ig1, followed by IgG2. Okay. Then it is also responsible for opsonization and neutralization. From SBA point of view, remember IgG is seen in the chronic infection. So IgG is a marker for chronic infection. Okay. Next type of antibody is a IgM type of antibody, and this is the picture of the or the structure of the IgM antibody. It is a pentamer. Okay, 1, 2, 3, 4, and 5. Okay, so this is the pentamer, and this is joined to each other by the disulfide bonds, and this chain is formed because of this. There is a joining chain, so it forms. It is present between the two, that is a joining chain. Okay, so this is how the IgM pentamer is present. Then what are the features of this IgM? It is the first antibody which is produced. It is pentamer having 10 valencies, and it is present only in the intravascular compartment. Okay, function, it is the acute infection marker, while IgG was the chronic infection marker. Here it is the acute infection marker, strongest complement activator, and agglutination will be strong agglutination here. Okay, so IgM in the newborn is suggestive of intrauterine infection, because crossing the placenta is a function of IgG type of antibody. So if you get the IgG in the newborn, that may or may not be the feature of fetal infection. But if it is IgM type of antibody, which is a primary response, if you get in the fetus, that is going to be the suggestive of intrauterine infection. The next class is a IgA type of antibody. This IgA is of 2 types. One is a secretory IgA and second is a serum IgA that is present in the blood. Now, the one which is present in the blood is a monomer. Okay, while the one which is present in the secretory or one which is a secretory in nature, that is dimer, plus it has got J chain, plus it has got a secretory component. Okay, so secretory is most commonly asked, but there are two types of IgA. One is a secretory IgA and a serum IgA. Serum IgA is monomer, secretory IgA is a dimer. Okay, and it also has got J chain and secretory component. This is located in the milk, saliva, tears, respiratory, and GI mucosa. Now, what is the function of this IgA antibody? It gives mucosal immunity. It prevents microbial entry. From examination point of view, remember, breast milk has got a IgA protection. Okay, so breast milk gives the IgA protection. The next most important antibody is IgE type of antibodies. This is present in the lowest concentration. It is heat labile. It binds with the mast cells. Okay, so this IgE antibody is present in the lowest concentration. Okay, what is the function? It is responsible for type 1 hypersensitivity. We will discuss about this hypersensitivity reaction after this. Okay, so it is responsible for type 1 hypersensitivity reaction, allergy like asthma, anaphylaxis, etc. These conditions, and helminthic related immunity is provided through IgE antibody. So this IgE antibody will cause mast cell granulation and degranulation, and that will be responsible for the production of anaphylaxis. Okay, so next is a class is a IgD type of antibody. That is the surface receptor on B cells. Function of the IgD is not well defined. Okay, so rest of the four you should know in detail. Now coming to the antigenic determinants of immunoglobulin. So what is the antigenic determinants of immunoglobulin? So there are different types of antibodies. That is isotype, allotype, and idiotype. Isotype, there are class differences among the antibodies, that is IgG, IgA, etc. That is within the same species you have different classes and they will be unique in that particular class. While allotype, there will be genetic variation within the species. Okay, within the species there will be little variation that is called as allotype. While idiotype, it is the unique antigen binding site. Okay, so that is the three different types of immunoglobulins: isotype, allotype, and the idiotype. So idiotype is a paratope specific. So paratope specific is the idiotype antibodies. Okay. Now some thing about abnormal immune. Whatever we have seen was the structure and function that we have seen with respect to the normal immunoglobulins. Now we will discuss about abnormal immunoglobulins. Okay. Again, the questions are asked on this topic also. Among the abnormal immunoglobulin, there is one important, that is Baines-Jones proteins. Here, there will be light chains which are present in the urine. It is seen in multiple myeloma, and unique feature is that it precipitates at 50 degree and dissolves at 70 degree. Okay, so there is a precipitation at 50 degree and dissolves at 70 degree. These are the light chains which are present in the urine, seen in multiple myeloma. Other conditions of abnormal immunoglobulins are: one is a Waldenstrom, where the IgM levels are increased. Okay, remember Waldenstrom. Here W is there, so opposite to W will be M. So which antibodies are increased? IgM type. Then heavy chain disease, where there are abnormal heavy chains, and third is a cryoglobulinemia. Here cold precipitating immunoglobulins are present. Okay. Another important concept is the monoclonal antibodies. What we have seen here was abnormal immunoglobulins, in which we have seen one is a Baines-Jones proteins, then Waldenstrom we have seen, then heavy chain disease is seen, we have seen, and cryoglobulinemia. Now the concept of monoclonal antibodies. These monoclonal antibodies are used in treatment also. Okay, so these are the antibodies from single B cell clone. Okay, so these are the antibodies which are produced from the single B cell clone, and they are specific to single epitope. Okay, so these antibodies which are produced by the single B cell clone, and they will be specific to the single epitope. And how these monoclonal antibodies, which technique is used? It is the hybridoma technique that is used. Okay, so this hybridoma technique. What is the principle of this hybridoma technique? It is the B cell plus myeloma cell leads to the hybridoma. Normally, we know that B cell will produce the antibodies. These myeloma cells, these are actually cancer cells, and these hybridoma is a combination of B cells plus myeloma cells. Now, what are the steps in production of these monoclonal antibodies? First is the injection of the antigen. Once you inject the antigen against which you want the antibody, okay, you want the monoclonal antibody, so you will first inject the antigen. What will happen? That will activate the B cell. So you will get the first component, that is the B cell. Okay. But these B cells are over a period of time they are destroyed. We want the monoclonal antibody which will persist. Okay. So first is a inject the antigen, you will get B cells. Okay, activated B cell. Then fuse these B cells with myeloma cells. These myeloma cells are continuously dividing cells. Okay. So what will happen? These B cells you are fusing with the myeloma cell. Then third step, you have to grow these in the hat medium. Okay. Then you use the hat medium. Once you club or fuse these B cells with the myeloma cells. What does this hat medium? They will only monoclonal antibodies will survive. Now, this hat medium is hypoxanthine, aminoterin, and thymidine. That selects only the hybridoma cells will only will select. Okay, so hat media only the hybridoma cells. Once you fuse with the myeloma cells, you will get these hybridoma cells, and only these hybridoma cell will remain in this hat media, while other B cells and myeloma cells will not be there, but only hybridoma cells will be produced. Okay, so application of the monoclonal antibodies, one in the diagnosis, it is used in ELISA, rapid test, antigen detection. It is also used in autoimmune diseases like anti-TNF. Then cancer therapy it is used. Okay, then passive therapy, reduce immunoglobulin and hepatitis B immunoglobulins, they can be produced via these monoclonal antibodies. Then it is also used for immunotoxin. Okay, so this immunotoxin will lead to the targeted killing. So these will kill only targeted cells. Okay, so this passive immunity gives immediate protection, while immunotoxin will use antibodies to deliver toxin to specific targets. So immunotoxin will deliver toxins to only specific targets. So that is one of the function of monoclonal antibodies. So just to revise, different classes of antibodies. IgG will cross the placenta and it is seen in chronic infection, while IgM is seen in acute infection and it is a primary response antibody. IgA gives mucosal immunity. Then IgE is responsible for allergy. IgD is a basal receptor. However, cellular function is not very clear. Then a FAB is the binding site. FC is responsible for effector function, papain digestion. What you get? Papain, you get two fragments apart. FC is preserved, while pepsin, you get only FAB portion together. You get FAB portion together, but the FC is lost in pepsin. Okay, pepsin. So FC fragment lost. Okay, then IgM is the strongest complement, and bench zone proteins are seen in myeloma. So this is what is about the antibodies. The topic is over. We have few questions. Dr. Sansi, you want to go through these questions?
Yes, sir. Yes, sir. A pregnant woman is concerned about protection of her fetus against infections. Which immunoglobulin is responsible for transplantal transfer of immunity? Sir, option D, IgG.
Correct. IgG crosses the placenta. IgG is the only immunoglobulin that crosses the placenta, providing passive immunity to the fetus. Okay. Next is next question.
A laboratory scientist analyzes the structure of immunoglobulin M. What is the total valency of secreted IgM? Sir, option E, 10.
Yes, it is a pentamer having valency of 10. Okay. IgM is pentameric, containing 10 antigen binding sites or valencies.
A
Next.
6-year-old child presents with fever and sore throat. Serology shows elevated antibodies indicating recent infection. Which immunoglobulin is most likely elevated? Sir, option C, IgE.
Why IgE here?
The fever, sore throat, allergy, maybe. Fever and sore throat allergy.
Is it?
IgM, IgM.
It is a primary response. No,
Yes,
we are
recent
looking for a
infection,
primary response. Yeah. So
IgM.
IgM is the first antibody which is produced in acute infection, marker of recent exposure. Okay. Next.
A patient receives an oral vaccine that induces immunity at mucosal surfaces. Which immunoglobulin is primarily responsible for this protection? Sir, option A, IgA.
Yes, this is frequently asked question. IgA. Secretory IgA mediates mucosal immunity. Last year only this was in respiratory, GI, and genitourinary tracts. Next.
Flow cytometry analysis of B lymphocytes shows surface immunoglobulins acting as antigen receptors. Which of the following combination is most accurate? IgA and IgE, IgD and IgE, IgG and IgA, IgM and IgD, IgM and IgG. Flow cytometry analysis of B lymphocytes shows surface immunoglobulins acting as antigen receptors. There are IgM and IgM and IgD.
IgM
The
D from
B
flows
cell
and
receptors, it is in B cell receptors, no, sir, IgD.
acting as antigen receptors.
Receptors.
Okay.
IgM and
This is
IgDs.
the only where Ig, IgM and
M,
IgD because
IgD.
D is the only antibody where this B cell lymphocyte are present.
Presence.
This, yeah. So IgM and IgD here. Naive B cells express IgM and IgD as surface receptors. Okay. Next.
A researcher studies complement activation by different IgG subclasses. Which subclass does not activate the complement system?
Yes.
Ig, which subclass does not activate the complement system? Ig1, Ig2, Ig3, Ig4, and Ig5. Sir, option Ig2.
Yes. Ig2. So
Ig4.
D is Ig4. So Ig4 does not fix the complement unlike other IgG subclasses. First thing, there are only 4 times. So Ig5 is not there. Okay.
Not
And
there, yes.
Ig4 does not fix the complement unlike other IgG subclasses. Okay. Next.
A patient with septicemia requires rapid immune clearance of bacteria via complement activation. Which immunoglobulin is the most potent activator of classical complement pathway? Sir, option E, IgM.
Yes. IgM we have seen. IgM is the most potent complement activator due to multiple FC regions. Okay.
Multiple
Next.
FC regions.
Next. Hello.
A microbiologist
Hmm.
observes clumping of bacteria in a test sample due to antibody mediated agglutination. Which immunoglobulin is most effective for this process? Sir, option E only, IgM.
Option E. IgM. Okay, IgM is most efficient in agglutination due to high valency. Next.
Yes, sir. A monoclonal antibody used in rheumatoid arthritis targets tumor necrosis factor alpha. What is the defining feature of monoclonal antibodies? Produces by multiple B cell clones, no, bind to multiple epitopes, no, derived from a single B cell clone, activates complement only, lack antigen specificity. Sir, option C, derived from a single B cell clone.
Yes, it is derived from single B cell clone. Okay. So monoclonal clonal antibodies, it is a single clone and that single epitope specificity. Next.
During production of monoclonal antibodies, heart is used. Hybridoma cells are selected using heart medium. What is the main purpose of this medium? Stimulate antibody production, select only fused hybridoma cells, destroys All B lymphocytes promote complement activations, enhances the antigen binding. Selects only, sir, option enhances antigen binding, promotes complement activation. Sir, option D promotes it, enhances the complement activation.
Height medium we have seen, no?
Yes, sir.
Hypoxanthine and
Myeloma
oh,
cells.
oh, it select
Select
only
only.
fused hybridoma cells. So height medium
Yes.
allows only hybridoma cells to survive. Rest will not
Okay.
survive. Okay. Unfused B
Okay.
cells and myeloma cells will not survive. But the fused myeloma cells with B cells will only survive. Okay.
Hmm.
What we want the B cell, but we don't want them to stop. It should be continuous. Okay. So we
Yes.
make use of myeloma cells. Okay. Then we
Hmm.
fuse B cells along with myeloma cells. So that becomes the
Yes.
hybridoma cell. So we want only
Yes.
these hybridoma cells to survive and not the
Hmm.
other unfused. Okay. So other two
Okay,
cells
sir.
will not survive if it is not fused. Okay. So that is all. That finishes the topic of antibodies. Thank you.